Hi everybody, Dr. Khan here from OKC Fertility, and today I'm just going to talk a teeny bit about fertility awareness. National Infertility Awareness Week is coming up, and so look out for more information from us about that. But I think it's obviously a really important topic all the time. I'm glad we have this designated time where we can kind of really focus on it because it's really important. Fertility awareness obviously takes many forms and shapes, but really what I want to focus on a little bit today is the things that I hear from patients that they wished they knew sooner about fertility. Some of the most common things I hear is, I didn't realize how common it was for people to struggle to get pregnant. And it's really the case. 1 in 8 couples is going to struggle or seek fertility treatment to help get pregnant, and that's not a tiny number. Why that is what it is, how trends have changed over time, that's just like a huge Pandora's box, and we can go into that at another time. But the point is, about 1 in 8 couples are going to struggle. Some other things that I hear are going to be, I did not realize how common miscarriages were. 1 in 4 women are going to experience a miscarriage, and that's not uncommon, and that is just, it's so tough. It's just a really hard thing to go through, and so it's just one of those things that we just kind of need to be aware of the landscape. So I think that's another big thing that I hear a lot of, that people wish they had known sooner. Other things are things like how your overall health can affect your ability to get pregnant. And so having chronic disease can definitely impact your ability to get pregnant. Some of the things that come to mind are like celiac disease, autoimmune diseases. Sometimes those things can affect our ability to get pregnant, and sometimes the treatment that we need for chronic conditions can affect our ability to get pregnant. So those are just things to kind of have in your mind, and make sure that before you're even ready to try, these are discussions that you're having with your doctor, so you're just more well informed and maybe you can plan things a little bit better. Speaking about medications ability to affecting your ability to get pregnant, another one I hear a lot is about testosterone. For guys taking testosterone, testosterone can lower your sperm counts, and usually that's reversible, so it's just a matter of getting off the testosterone and having a really good rebound in numbers. That's what I see most of the time, but it's important to know that can play a role. So that's another big one. Another thing is how prior pelvic infections can affect your ability to get pregnant. So having a pelvic infection like gonorrhea, chlamydia, or having pelvic inflammatory disease in the past, those things can possibly damage your fallopian tubes. Not everybody, obviously. Ends up having a problem, but occasionally it really does happen that if you've had a prior pelvic infection, you might end up with some underlying tubal damage or even blocked tubes. So I think that's a really important one, because when you are younger and when you're going through sex ed and when you're in college, the focus is just don't get pregnant. If you look at a boy, you're going to get pregnant. And there's just so much more to it than that. And this sort of gets into my own little personal soapbox, where I feel like our sex education is really lacking. We've looked at this before, just in terms of what we focus on in the public school system for sex ed, and it's just abstinence. And it's like there's no other options, and that's not really realistic. So probably I'll talk about that at a later time, but the point is that we're not doing a really great job of educating our young people about the things that are going to matter to them later. When you're in high school, you might not want to be trying to get pregnant, but that might be something that you want later, and you might not know that you want it later. And so it's important that we give everybody the information that they need to protect their bodies and to stay safe. So, it's just really always important, if you're worried about an exposure from a sexually transmitted infection, to go have that checked out. And obviously always practice safe sex. And let's see, I'm rambling. I'm a rambler. Other things that people really wish that they had known sooner was age-related fertility decline. That's definitely something that I hear a lot. I really wish I knew that it's harder to get pregnant when you're older. My grandmother had kids when she was in her late 40s. I hear that so much. And so I think that's an important one, is that it really looks like it's harder to get pregnant as we get older. After you start hitting 35, 38, 40, it just gets a little bit harder. We really think that has to do with a higher percentage of genetically abnormal eggs as you age. Our data probably indicates that, like, under 35, you're probably maybe at most like a third, maybe a little higher of your eggs is genetically abnormal. But by the time you hit 38 to 40, it's like 75 to 80%. Why that is, that's again a whole nother down the rabbit hole, maybe for another day. But that is definitely something that we see, and it's something that a lot of people wish they had known about sooner. And the last thing I do want to touch on is really about egg freezing. It's about fertility preservation. A lot of people don't realize that that is 100% an option. If you're not ready to have kids right now, you can potentially freeze your eggs, and then when it's the right time for you, you can thaw those eggs, and then you can mix them with the sperm of a partner or a sperm from a donor, whatever is in your plans, and then you can try to get pregnant at that point. And these are younger eggs, and so they're less likely to have any genetic abnormality. And so that's another thing that I hear a lot, like, I really wish I knew that sooner, because it really does just extend that window. Because we take these eggs, we freeze them, and so they're almost in like a suspended animation, if you will. And they, our data indicates that they really appear to work perfectly well for the most part after they're thawed. I mean, not that long ago, there was actually a baby born after it had been frozen for 17 years. So the technology here is really amazing. And these are kind of just the big things that I hear about when people talk about what they wish they knew sooner about fertility. So, as always, we want to hear your thoughts. If you have other things that you wish you knew about sooner, we want to hear about that and just kind of open the dialogue and get the message out to more people. Connect with us at okcfertility.com. Follow us on Instagram and Facebook. Thanks, guys. See you next time.